Hello, I'm Dr. Tay. Parents always worry when their child has frequent nosebleeds. However, nosebleeds in children are quite common. Let me share why it happens and what you can do to treat and prevent it. Nosebleeds can happen when the air is dry or when a child rubs, picks or blows his or her nose vigorously. It happens when blood vessels inside nose tissues are broken. This may occur in one or both nostrils. Nosebleeds in children often happen in the front or anterior of the nose, where there are many tiny blood vessels. Children have thinner skin. The skin and blood vessels are easily damaged when a child rubs his or her nose. Children who are allergic to allergens, such as dust mites, mold, or pollen, may experience frequent stuffy nose, sneezing, itching, or a runny nose. All these symptoms can cause and aggravate nosebleeds, as children may pick or rub their nose roughly, resulting in trauma and thus bleeding. Nosebleeds in children are usually not serious, and most will outgrow them. Get your child to sit upright. Lean forward to stop him or her from swallowing any blood. Blood may irritate the stomach and cause vomiting. Encourage your child to spit out any blood that drips into the mouth. Next, firmly pinch the soft part of the nose for 10 minutes. Do not release the pressure. Ask your child to breathe through his or her mouth. This should stop the bleeding. If the bleeding persists after 20 minutes, keep applying pressure and bring your child to the children's emergency. If ice packs are available, you can apply them over your child's forehead, as this should help to reduce the nosebleed. At the hospital, the ENT doctor may conduct a nasal endoscopy investigation to check for any source of bleeding within the body. If your child is suitable for the procedure, a thin, flexible scope is inserted into the nose. Sometimes, we cauterize the front part of the nose with a chemical stick to seal off the blood vessels. This can be done in the clinic for older children. However, for younger children, anesthesia may be required before the procedure. Blood tests may also be performed in some cases to check for hemoglobin levels and to exclude any bleeding disorders. Following the acute bleeding episode, your doctor may order a skin prick test for your child to rule out the possibilities of allergy conditions that could cause and aggravate nosebleeds during the consultation. Let me give you some tips to prevent nosebleeds. You can apply a small amount of petroleum jelly twice a day to your child's nasal septum. This is the wall which separates the left and right nostril, and this helps to relieve dryness and irritation. You may also use a humidifier if your child sleeps in an air-conditioned room at night. Moisturize the nostrils before blowing a stuffy nose. If your child has a cold, apply 2 to 3 drops of warm water to each nostril, or use a saline nasal spray in each nostril before they blow their nose. If your child has a nasal allergy, antihistamines can help to prevent nose picking, rubbing, and blowing, which causes nosebleeds. If you are concerned about frequent nosebleeds, please consult a paediatric ENT specialist. I hope this has been useful. Thank you for watching.